Well, aloha and good morning. Thanks so much for tuning in here to Spotlight Hawaii. I'm Ryan Kalei-Suji, joined by Yunji Denise, and we want to thank all of you for already tuning in this morning. This morning, we have a very special guest that's going to talk a little bit more about not only our Safe Travels program that we have here in the state of Hawaii, but future plans moving forward on how the state continues to combat COVID-19.
That's right. We want to welcome live Major General Ken Hara, who is in charge of HAIMA and the state's response to the COVID-19 pandemic. Thank you so much for being with us this morning, General.
No, thank you for having me.
Let's start out with just a broad basics. How are we doing as a state when you look at the trajectory of the pandemic? How are you feeling about where Hawaii is right now?
Well, Hawaii is doing really, really well. And we have been from the beginning. If you look throughout this pandemic, Hawaii has probably the lowest numbers of infections, lowest number of hospitalizations and deaths since the beginning. So we're doing really well, and we were trending downward, and I like what I see.
You know, one of the things, of course, that falls under your supervision and something that you've been working on has been the Safe Travels program. We know that there are some changes that is coming to the program with recent announcements from the governor. Can you talk us through what those changes look like, and from a logistical standpoint, how all of that will be unrolled as we move through this? Okay,
so the first thing, I'll try to do this in order. And so the first one is on 15 June, the counties will no longer be screening for any inter-island travel. So that means no pre-test, no post-test, no vaccination cards. You don't even have to register into Safe Travel. It'll be pre-COVID. You just, get on your flight and fly. Then when we get to 60%, we're going to allow anyone that was vaccinated in Hawaii. So that's either shot. So if it's a 2-shot series, either the first or the second shot in Hawaii, and then it's fully vaccinated. So on day 15 following your shot, that you'll be accepted from the Safe Travels. And that's anyone, or you don't have to be a resident of Hawaii as long as you got the shot in Hawaii. And then when we get to 70%, if everything is looking good, then we drop the Safe Travels Hawaii program altogether, which I'm really looking forward to.
There was an article, it's the lead story in the paper this morning, that says that we're not seeing this rush of people getting vaccinated since the governor announced his Hawaii Get Vaccinated program on Friday. Of course, it's very early still. Mm-hmm. He just announced those prizes that could come along with getting a vaccine. But what are your concerns? How long could we be in this interim period trying to get to those 60 and 70% thresholds?
Yeah, so personally, I think these incentives are going to work. What I really want is, with the governor announcing these different thresholds, that other people will try to educate their friends and their family and say, hey, the vaccine is safe and effective. We're seeing that because you look at the numbers in continental United States, they're starting to open up widely, but yet their numbers are trending down. And it's the same for Hawaii. And, very few, major side effects. Most of it is just, a little bit of flu-like symptoms for a day, and that's it. The risk is if you get sick, then you have the virus in your body and you're sick for a very long time. And, you could end up being in the hospital, worst case, even dying, or giving it to one of your close friends or family members. And then we talked about the benefits, the benefit of preventing yourself from getting sick, the benefit of helping the state to eventually get to herd immunity, and also the benefits of all the incentives that the governor talked about. What's really interesting is, so after the announcement, I started tracking numbers more closely, and we're averaging anywhere between 4 and 17 doses per day, because we're trending down. And then today's numbers, I looked at it, I think it's about 16,000 they got vaccinated. So like you said, it's kind of early, and I think we're going to see a spike in people wanting to get vaccinated.
We know that those who are entering the state right now have the option of course, verifying with that trusted partner test, a negative test, if you will, or they have the option of going into quarantine. Are we still seeing individuals arriving in the islands that have chosen not to get a test and opting for that quarantine period? And what do you have an idea of the average, on average, how many people are still coming into the state that aren't getting those tests?
Yeah, sure, Clay. So, there are people that still elect to go into quarantine. I think so. It's about anywhere between 3 to 5% on a daily. And if you look, since we started this, it's at 3% of travelers that came into Hawaii that elected to go into quarantine.
And of those folks, we have some questions here, and I don't know that this might be better suited for the Department of Health, but we'll see if you can take a stab at it. Lorianne is asking, are people with COVID in the hospital vaccinated, or did they get COVID before being vaccinated? How, there are these talks about these cases that break through. Are we seeing those folks actually end up in the hospital? Because my understanding is that those cases are relatively mild.
Right. So that is a question for Department of Health. But when I looked at it, there are less than 100 breakout cases, and of those, I believe only one was hospitalized. So everyone has very, very mild symptoms, similar to a common cold. But for the exact numbers, please refer to Department of Health.
I want to go back to those who have chosen not to get the test, and you said those 3 to 5% of people that are choosing to head into quarantine. What are the procedures about following up with those individuals? Is that something that you folks are still doing? Because we know that early on in the pandemic, that was an issue, that many people were breaking quarantine, and it became somewhat of a contentious issue, if you will, between those in the community. Are those who choose to go in quarantine, are they being followed up with that protocol? And if you can talk us through what that looks like.
Sure. And the answer is yes. So you know what, Ryan, what I'd like to do is kind of walk us through, because we have what's called a layered approach to mitigating risk. And you guys kind of hit on some of the things there. So the first thing you need to do is get into the Safe Travels Hawaii digital platform. You register online, and then you fill out the forms. And then you do an attestation. Then we do the screenings. Most of the screening now is at it's called pre-departure document check, or PDDC. And just recently, we had 2 airlines that were kind of holding out on this, but they finally agreed to. So we have 100% of domestic flights coming into Hawaii are going to start doing the screening. We're about 60%. We expect that bumping up to about 75 to 80%. Those will be pre-screened. So you just come in and you walk through, you're not even checked. So the lines will go down. So you got the safe travels, you got the screening, then we have the trusted travel partner. You need the 72-hour PCR test. So CLIA certified lab, nucleic acid amplification test, 72 hours prior to departure, you come in and then you get screened. And if you elect not to do any of those, then you get placed into quarantine. And then the system itself will do it's a bot check. So you get texts from the system, you get phone calls, and then you even receive emails. So that you got that going on. And then if you don't check in, law enforcement will be notified. And then law enforcement periodically checks up on travelers that are in quarantine. And they do it on all the islands. The counties do the checks for the neighbor islands. And then for Oahu, it's the Attorney General's investigators that do the compliance checks periodically.
You talked about getting to that 70%. And once we get to that 70%, my understanding is the whole Safe Travels program stands down. Can you talk a little bit about what that would look like? I think a lot of people in our community, even though we would be at 70%, might have some hesitancy about just welcoming visitors full throttle with no kind of check. Why do you feel comfortable standing down that program at 70%?
Initially, so like right now, majority of our travelers are coming from the continental United States or Alaska. And I mentioned earlier that the numbers are trending down. The vaccines have been very effective, and that's why they're going down. So I'm really comfortable if we get to 70%, because our population will be protected, and especially those at greatest risk, the 60 and older, that will be safe to open up. What I'm not as comfortable with is some of the variants that are spreading primarily in Europe. We got the India variant that I'm not as familiar with. So what I plan to do is we'll have some funding set aside, and possibly we'll watch the numbers. And if we think that our vaccines will not be effective against some of those other variants, then we may do screening just for international. But if everything is looking good, our plan is to shut everything down.
If we can expand a little more on that international side, is there any idea of when that could happen and what that approach would be? Could it be by countries first? Is there designated countries that might have more leniency? Maybe say those coming from Canada as opposed to those coming in from Japan. I mean, when you consider there is a lot of different components once you open this up to foreign travel, how do you think that will unfold as all that develops?
I think as we're approaching, it's really up to the countries, right? Because sovereign nations, they are actually restricting. So as an example, Japan, people from Japan can travel to the United States. However, when they return, they're placed into a quarantine. And then we do have trusted travel partner relationships with Japan, South Korea, Taiwan, and Canada. So my expectation is if there is still a huge spike and we're concerned, we could still leverage the Safe Travels Hawaii program.
And that would be just for international. Now, what about those travelers who you mentioned Europe? A lot of those travelers may do take a week in California and then come. How would we sort of suss out those folks? Would it be anyone with a foreign passport would have different restrictions, or would it be only flights originating from a foreign destination? How do you sort of weed those out?
It's going to be only flights coming from an international destination, because it's hard for us to be able to screen those out, right? If somebody flies to San Francisco, as an example, maybe spends a few days there, but have not been there for 10 days and come here, we won't know that unless they actually self-report. I think it'd be way too difficult for us to screen that out. And to be honest, even if we tried it, it wouldn't be worth the effort.
We know that there has been a lot that has been done in the airports to stand up these programs, a large military presence with the National Guard as well, assisting in those areas. I'm wondering what other areas the National Guard and those that you oversee are continuing to help in this battle with COVID-19, because early on we saw them in really all different sectors, from contact tracing to unemployment. I mean, they were just everywhere. Where are some of the areas right now that you continue to help support in this battle against COVID-19 in various departments?
Well, the first place is everybody needs to make this happen, right? And so we have some guardsmen on as part of the command and control that that runs everything, does the plans, does the execution, gives the orders. Most of our support is to the State Department of Health. We have some guardsmen, very, very few, but staff augmentation. We're doing mobile testing, COVID testing, training and education, vaccinations, and then the contact tracing, right? Remember, that was the big thing that the public was really upset about in the state legislature. So, we're able to come in and augment the Department of Health. And then for the counties, we're doing vaccinations, contact tracing. On Kauai, we're helping with airport screening, but I believe that's going to be scaled down as we do away with the international travel. And then for Hawaii Emergency Management Agency, staffing support, pretty significant staffing support, and then a lot of personnel helping with warehousing. Because remember, we spent almost $100 million on personal protective equipment and industrial hygiene products. And the demand is not as great as we had expected, because the cases are going down, schools weren't in session, so there's no need for the PPE. So we have a lot of stockpile in warehouses.
A large part of our population here in the islands, of course, are members of the military. Can you tell us a little bit about the vaccination rates among the members of the military, and are they better than the general population or about the same?
So here in Hawaii, they're better than the general population. About 75% have received at least the first dose. And then I sent the message to U.S. Indo-PACOM just last week as the governor was making his announcement for the incentives, asking all of the commands to see if they can try to help push again to incentivize their soldiers, sailors, Marines, and airmen to get vaccinated.
You mentioned those mobile testing stations that continue to go out. How long do you think we'll continue to need those? And do you see that continuing on for some time, where we will have these testing mobile units and stations going around?
And again, the answer is yes. When we looked at the COVID response, working with Department of Health, they developed, or they had our response focus on what they called pandemic control measures. So we had prevention, detection, containment, and treatment. So in the containment, if you don't know if there's a cluster forming, if you're not testing, and then it could spike out of control pretty rapidly. So I see in the long term, Department of Health will still need mobile testing capability. So as soon as someone is positive, we can send them out there. You know, the guardsmen went out to almost every single spike in the prison system, and we were the ones in the lead doing all of the COVID testing. But that being said, we're trying to off-ramp the National Guard with a lot of these different requirements and mission support, and asking the counties and the state departments to see if they can contract civilian capability, because it's a lot cheaper.
D. Kanoa has an interesting question. You know, we've focused a lot on safe travels and people coming to Hawaii through the airports, but she's asking about cruises. What are travel guidelines and safety for cruise ships coming to Hawaii? When could we start to see those folks come back? And what kind of protocols are in place to keep that safe?
Yeah, so we're working closely with the cruise liners. Department of Transportation harbors are in the lead. We had meetings with the governor and all of their leadership. They're looking at right now having 100% vaccination rate to come in, and then testing, and then having capabilities on the ship to be able to quarantine. So still work in progress, but it looks promising. To be honest, I think it'll be safer than the airlines once they're open up.
And how soon could that be?
I don't know. I think they're targeting August, but I wasn't keeping track that closely.
You know, you had mentioned earlier about just how much it costs just for the guardsmen to be out and for there to be a presence here assisting in all these different areas. I'm wondering overall, I mean, how long do you think the state can afford to continue on this process? That you had mentioned that you're mentioning to the counties to maybe look for civilians. How long do you think the National Guard will be in place in these areas, and how long will the assistance be needed? And when could we see things return to a normal schedule?
Some of the projections are looking at the state of Hawaii getting to that 70% somewhere in August, September timeframe. What's really good for the state of Hawaii and the other states as well is that the federal government, for the first time ever for disaster response, authorized and provided funding with federal dollars. So it's under Title 32 502F. Again, that was the first time ever that the president, FEMA, or the Department of Defense allowed federal funding for disaster response. So it hasn't been costing the state anything. And generally for disasters, it's a 25% cost share for the state. So, you know, 75% federal funded, 25% state. And in this case, both President Trump and now President Biden said, no, it's 100% federally funded. So it's not costing the state anything. Our current authorization is through the end of September. Our funding has been coming in 2-month increments. So our last request for August, September went in, and we're waiting for approval.
Stephanie has a question that we kind of touched on at the top, but just like to get your sort of estimate. How long do you think it'll take to get to the 60 and 70% threshold set out by the governor, given the current vaccination rates? I know you said that you've seen the numbers start to go up already, but how long do you think it could be while we're in this sort of waiting period?
Yeah, I'm not the scientist, but my estimate is about maybe 9 July, getting to the 60%. And then again, I'm thinking the end of August, possibly September. If I get all of the help from you, from the public, you know, peer pressure is the best thing, right? Talk to your friends, talk to your family. Hey, bro, please, I'll go Vegas, get vaccinated. Help us incentivize and talk about what I said, right? It's safe and effective. What are the risks if you don't get vaccinated, and what are the benefits? Help spread the story and try to convince people. But I'm thinking late August, September, we should be out of this.
I'm wondering if you can share, you know, as someone that's had to stand up this safe travels program and work with the Department of Health and work with the different state agencies and everybody that has been involved, what has been some of the things that you've learned through this process? Because, you know, this is something that you folks had to stand up from the ground up in a matter of time to make it something where everybody could use and make it user friendly. Looking back at that, all of this now, what do you think you guys have learned from this and this entire process?
Well, the first thing I learned is that I should have gotten into a different career field. But yeah, it's been extremely challenging. What a tough year. But that said, I really, really believe that the experience, the knowledge of the military, we plan to go to war, right? We plan to fight a dangerous enemy, which is what COVID is. And we took those skill sets to come up with pretty comprehensive plans. When we launched Safe Travels Hawaii in October 15, right, 2020, there's so many critics saying, "Oh, you guys are going to fail. There's no one person leading this," which is baloney. I was in charge from the beginning. We had multiple planning efforts. It was collaboration with all the departments, nonprofits, civilian, public-private partnership. We had great ideas, and we rolled out the program with nearly, no major complaints. And the same thing as we added to it, we just kept improving on it. So I definitely think having the National Guard involved in major disasters is a good thing and something we should continue on.
Given all the work and energy that you put into launching that program, are you at all concerned that if we stand that down and we do have spikes with travelers coming in who are not tested and perhaps not vaccinated, on what it would take to actually stand that back up?
Yeah, what we're thinking is so Roberts Hawaii, the ones that does the screening for us, possibly keeping them on screening, maybe initially just the international, so that we can surge if possible. But again, I'm going to rely on the Department of Health to let myself know, and the mayors and the governor, that hey, it's still too risky to open up widely, or they feel, the epidemiologists are the experts. They feel comfortable that the state of Hawaii can relax all of the restrictions.
And we've heard stories of these extremely long lines at the airport and people waiting for hours just to get through that. How is the state kind of addressing that, and how are you folks looking to alleviate that? I know he had mentioned that there could be some changes on the travel end, but if you can address some of those lines and what's being done.
So what I talked about was the pre-departure document check, or PDDC. So most of the screening is done at the destination airport. So when they come in, the lines are almost down to nothing now. Only the two airlines that have not joined in on this PDDC is where we get the huge backlog and long lines. But now that they're coming on board, I see those lines going away. I mean, like United, you literally, if you have your wristband, you just go to the left, not even checked. You just walk right through. It's really quick.
Early on, there had been a lot of talk about doing vaccine verification for non-residents of Hawaii, and now we've really pivoted away from that. Why was that abandoned, if you will? Why not try to effort that? Was that just too logistically complicated? Going back to getting to the 70%, I still think a lot of Hawaii residents would feel a lot more comfortable if there was some kind of vaccine verification to at least know that the people who are coming here, like 70% of us, are also vaccinated.
Right. Yeah, I guess I forgot to mention. So when we get to 60%, we're gonna, I think it was 60. Oh, shoot, I'm pretty sure it's 60%. We're gonna allow those that were vaccinated in the United States or any territories to receive a vaccine exception. And the Enterprise Technology Services, ETS, which is the state's information technology, they're the ones that help to launch the digital Safe Travels Hawaii digital platform. They feel confident they'll be able to build in a system to do checks. But what we also did, and more important, is we're partnering with third-party vendors. So companies like, I don't remember them all, but Common Pass, Clear, I think it was Azure, First Vitals, and there may be one or two others. They saying they're working on a capability to be able to verify individuals' vaccination status. So if that's the case and we go to them, more than likely we'll off-ramp the Safe Travels Hawaii, and then they'll be the lead for both testing and also vaccination validation. So that's the future for Safe Travels Hawaii.
You know, another thing that early on many were calling for is more testing sites on the mainland to have more trusted travel partners.
Mm-hmm.
Does that continue to move forward? Are you happy with the amount that you have now, or are steps being taken to add more of those trusted travel partners to give people more options?
We definitely wanted to add, make it easier for the travelers. The third-party vendors, once we onboard them, if we bring 2 on, we're talking about possibly 60,000 additional locations. Currently we have only like 30 places that they can 30 organizations that are trusted travel partners. And then now it's going to open up to the tens of thousands. So that's why we're really pushing to get these third-party vendors to do our validation.
I want to go back to that that clarification that you made about the when we get to 60% and having outside residents then being able to do that kind of vaccine verification. Why not just keep something like that in place even after we get to 70%?
The biggest thing is cost. And then actually, really, the more important one is once we get to 70%, more than likely the emergency period will end. Because we cannot justify, infringing on people's rights and freedoms. So in conversation with the Attorney General, they're thinking, August may be, when our current emergency proclamation ends, that may be the last one. Then we have no legal right to be able to do this screening.
Our time here is wrapping up, but did want to provide you an opportunity to have any last closing remarks or words for those viewers out there who are looking forward to some of these changes that are happening, potential changes, I should say. We can't get ahead of ourselves. We need to make sure that we hit those benchmarks. But your final thoughts about some of the things that you folks are looking forward to with these new hopeful changes as we ramp up in the vaccine process.
Yeah, I just want to ensure everyone, we are not worried, but focused in on the public health for everyone in the state of Hawaii, our visitors, our residents, the military. So we're not going to make these changes unless we absolutely feel confident that it's safe to do. And you look at the numbers, Hawaii has always been a leader in ensuring that Hawaii is a safe place. With that said, I really implore you to, if you're on the fence and thinking about getting vaccinated, do the research, get on the web, look at, remember I said safe and effective, what are the risks and what are the benefits? And I hope you decide to get vaccinated. It is your choice. There are some that absolutely will not. You got anti-vaxxers, religious reasons. I respect that. But if you're considering it, you're not too sure, I really would like you to get vaccinated, because that's the only way we'll get out of this.
Major General Ken Hara, thank you so much for spending so much time with us this morning. We really do appreciate it.
Sure, great. Thank you for the opportunity.
Mahalo, aloha.
Well, great to hear from him, and interesting to hear his projections on that timeline on when we could get to those 60 and 70% benchmarks. He's estimating sometime early July for the first one, and then perhaps a month or two later for that second 70%. You look at the paper this morning, there are some who estimate that it could be as late as October, but he is optimistic that the governor's incentive program, along with the public information push and just making, these mobile clinics and just making the vaccine more widely available, can have the intended effect.
Yeah, but if we also go back to what the governor said on our conversation with him on Monday, he also says that they will continue to track this, that if the state doesn't look like it might not hit that 70%, that doesn't necessarily mean that they will continue what we're doing on. They could potentially adjust that number if he feels that the state is safe. And that they are seeing some of the numbers that are looking promising. And so while 70% is that benchmark, there may be some flexibility in that. Also interesting to hear about his comments of those who are continuing to forego any testing and going into that quarantine. He's saying about 3 to 5% of individuals are still deciding not to take a test when they arrive here and are opting for that quarantine period, and that there are still checks that are being made on those individuals who choose not to go through the safe travels testing process.
Yeah, we see a lot, reading just your comments, there's a lot of apprehension about getting rid of the Safe Travels program and getting rid of those testing or vaccination verification requirements. That's a conversation that's still ongoing. You heard him say there at the end that once we reach those thresholds, we might not have the authority to actually have any limits in place. So there is that question as well. Also, it does come down to funding. They do have what they need right now, but it is not limitless. So there are some restrictions there. And again, you heard him really encouraging folks he said peer pressure is the best sort of tactic they have right now to encourage your friends and neighbors, offer to give a ride and tell them about your own experience if you have been vaccinated so that we can get to those 60 and 70% benchmarks.
And we'll see what happens when international travel returns, that there we could see the Safe Travels program return for those vaccine verifications for those international visitors coming into the islands. As he says, they have not yet had the ability to determine some of the other variants that we're seeing in other parts of the globe. And so that may be another factor that they put into play, is making that vaccine verification and that safe travel process necessary for those international visitors. So a lot to unpack there. We really appreciate him coming on board, and looking forward to our conversation on Friday as we continue to focus in on the travel sector and its impact here in our community.
That's right. We are going to be talking to Kelly Sanders from Highgate. They run a number of hotels here in the islands, along with Mufi Hanneman from the Hawaii Tourism and Lodging Association, to just talk, a travel and lodging association, to talk about what hotels are doing to keep safe and what the industry is looking at overall. We're seeing arrivals increase. A lot of folks coming to Hawaii. We're getting used to sharing the beaches and the roads with visitors again. There is some tension there that we've addressed with a number of guests. So how do we continue to welcome these folks back with aloha, get these jobs back up, but also figure out how to share our islands in a productive way? So we'll be talking about that on Friday.
Yeah, looking forward to that conversation, and thank all of you for tuning in here today. We'll see you right back here on Friday at 10:30 for another Spotlight Hawaii. Aloha.
Aloha.